My next guest is Dr. Edith P. Mitchell, one of 3 members of the President's Cancer Panel, which I just mentioned a moment ago. It's a group tasked with reporting to the President on barriers to progress in reducing the burden of cancer. She's also a clinical professor of medicine and medical oncology at Thomas Jefferson University, and very cool, she is a retired brigadier general, and she was the first person, the first woman in the Air Force to achieve that rank. I don't know, Dr. Mitchell, General Mitchell, it's really great to be with you. It's an honor. Look, I mean, I think part of the question of cancer, and I have learned this by being out in the field and talking to people, is making the ecosystem as inclusive as possible. And that goes from patients in clinical trials to the doctors that are in the system, right, to the various researchers there. And I know you've been carrying this a long way. I'd like our audience to know, where are we succeeding and where are we failing?
So thank you so much for the opportunity to be here today. And thank you for the invitation. I'd like to make one correction, please.
Oh.
I was not the first woman to be promoted to Brigadier General. I was the first woman physician promoted to be Brigadier General.
Even better.
Well, thank you. So the President's Cancer Panel was a part of the National Cancer Act of 1971. You have heard a lot about that from Dr. Sharpless. And the President's Cancer Panel was established really to try and bring together many different individuals. And the President's Cancer Panel utilized the fact that there are 3 members appointed by the President of the United States. And the current panel includes me, but also Dr. John Williams, a noted breast cancer surgeon, and Mr. Bob Ingram, former chair of the CEO Roundtable on Cancer. The panel conducts a series of meetings on a selected topic to gather input from key stakeholders and experts. So informed by this information from key individuals and a great diversity of individuals, we want to inform the President on some of the gaps. How can we reach them? And our upcoming report should be out within the next 2 weeks, and that is going to focus on disparities in care, as well as early screening as a method of finding cancers early. And the earlier you find a cancer and you're able to diagnose and treat the patient, that leads to enhanced and improved outcomes. So this will be coming soon. There have been a number of noted variances and ideas reported by the President's Cancer Panel over the years. And of course, the first was by Dr. LaSalle Lafall, who was chair of the President's Cancer Panel from 2002 to 2011. And Dr. Lafall, he was a mentor for me. He was a brilliant surgeon and educator who emphasized breaking down the color barriers was an important effort. So not only was he chair of the President's Cancer Panel, but he was the first African-American president of the American Cancer Society, as well as the first African-American president of the American College of Surgeons.
Right.
And he was chair of surgery at Howard University, where he has been labeled as the surgeon who has taught and influenced more African-American surgeons than anyone else in the country. So making sure that we have enough clinicians and other healthcare providers in the country that are members of desperate communities or of individuals from other communities. This is so important. And that is a part of what we do.
Right.
Now, one of the things that we do is bring together all of the stakeholders.
Right.
So the government stakeholders, the private organizations, individuals who have been affected by cancer, and the healthcare providers. So making sure that we have all of the stakeholders involved and we have collaboration in the efforts to move forward and to answer some of the questions related to cancer, but not only to discuss them, it's to know what to do to fix and enhance the effectiveness of all stakeholders, and that they're all working together.
Right. Well, thank you. That is a very full. There's this term I know of, Edith 360. I've been hearing of it. You can go in a little bit, tell us about the full picture. I think we got an Edith 360 of a lot of different dimensions of the picture. But let me ask you a question. And I'm very aware that, and this is not to make our sponsor Illumina happy, but Illumina and many other companies are bringing new technologies, new therapies. They're looking at new screening tests in various ways that Dr. Sharpless just talked about. One of the questions I'm wondering is, we're at this time when there's so many changes, but one of the horrible features of the American health system now, it's just a reality, is that there are communities that are not benefiting in an even way across the country. We saw this in COVID. We've seen it in cancer. We see it in Black maternal mortality, which I find outrageous. And so when you kind of look at that, I'm wondering, as new technologies are brought on, is there a way to, like particularly with the FDA, typically going through clinical trials, begin preferencing communities that have been, behind, preferencing or bringing in a requirement, higher participation requirements to get are there ways to adjust that so that we can kind of leapfrog out of this thing that there are a lot of Americans of color particularly who are not living as long, not benefiting as much in the American healthcare system? I'm just interested in your insights of what can be done, because we talk about it a lot, and I'm trying to find the ways, the constructive ways to change that equation.
Certainly. And one of the ways is to increase the number of practitioners and clinicians who understand these communities, who are members of these communities, who know these communities and how to engage the communities. It has been known for some time that the burden of cancer does not affect all populations equally. And in 1975, for example, 4 years after the signing of the National Cancer Act, in a comparison of the mortality rate for Black Americans, it was 20% higher than for white Americans. 15 years later, in 1990, this disparity was even greater, with Black Americans facing a cancer mortality rate that was 30% higher than white Americans. And at that time, those were the only two groups that we collected information. About 2000, we started collecting information on other races and ethnic groups. And what we know is now we're collecting all of this information, but with increasing the number of practitioners from the various communities and bringing together the research entities with the new technologies, we can provide this to everyone. So it is so important that we make sure that all individuals, all states, all communities have access to these new diagnostic and therapeutic entities. And we're also moving toward using some of the recent technology, the research that is being done, to find individuals earlier, diagnose the cancers earlier, but also understand individuals who might be at risk for developing cancer, but who have no evidence of cancer now. So if we can use these technologies for prevention of cancer, provide that to all of the communities. We know that cigarette smoking predisposes individuals to lots of different cancers. And therefore, if we can eliminate the causes of cancer, know the population as well as the individuals who are at higher risk, bring all of our stakeholders together.
Right.
And that includes insurance companies and federal agencies, so that we are providing equal care to all individuals in this country. So bringing stakeholders together and having them work in unison.
Well, Dr. Edith Mitchell, again, the first woman physician to reach Brigadier General status. Really want to appreciate your comments and thoughts on this and about this notion of bringing the different dimensions together. I look forward to reading more of your work about the President's Cancer Panel. Thank you so much for joining us today.
Thank you, and thank you for the opportunity to discuss the President's Cancer Panel. And I encourage our audience to search our website. And thank you so much.
Thank you.